My name is Terry Duran, and I'm a nurse practitioner. Now, if I were to use the word mask, it might get some people riled up in our day and time. But if I use the word respirator, some might get confused about its meaning. And that is what we're going to learn about today. Today, we are going to spend our time digging into respiratory protection as we talk about particulate respirators and OSHA FIT testing. Now, this may not be always the most exciting subject, but it is a subject that protects you and protects others from harm. Our objectives today are to talk about why respirators are needed and how they work, when and how to use a respirator, the purpose of the medical evaluation and clearance for wearing a respirator, the training requirements, how to safely put on and take off a respirator, and FIT testing requirements. Why is this course needed? Now, the most important reason is that it is for our protection. But another reason is that it is federal law. Now, if it wasn't federal law, we probably wouldn't teach it. So wherever respirators are required, employers must implement a written worksite specific respiratory protection program, including a medical evaluation, FIT testing, training, and other elements as specified in OSHA's respiratory protection standard. There are many diseases that are airborne and many factors that affect that risk. Aerosol studies show that infectious particles are released from a patient's respiratory tract in a wide range of sizes, and the size of a droplet or particle quickly decreases as water evaporates from it. Particles up to 100 micrometers in diameter are known to be breathable into the nose or mouth. Smaller particles stay airborne longer than larger particles, which increases exposure time and the distance the particles might travel. Particles of various sizes can remain suspended in the air for hours, especially with high rates of air movement in the room. Small particles can travel on air currents and potentially be carried long distances from the source of generation or origin. The other factor affecting risk of infection is how long a specific pathogen can remain in the air or remain alive and infectious while suspended actually in the air. There are many diseases that are airborne. Measles, tuberculosis, the flu or influenza, pertussis, rhinoviruses, chickenpox, and these are just to name a few of the more familiar ones that we think about. So take a look at this picture. What emotion comes to mind? We have this risk of exposure. Someone sneezes into the air and a large number of infectious particles spray into the room. Others inhale these infectious particles through the room air, through their noses, and they are absorbed through the mucosa. But disease transmission can only occur if the organism remains alive and infective while it is in the air, and enough particles are present to represent an infectious dose as it is breathed in. But the host is infected with the disease. Now, COVID-19 or diseases like the flu are spread primarily through these droplets when people do things like talk or laugh or cough or sneeze. But it also can be spread through touching something with the virus and then touching a vulnerable area like the mouth or the nose. And it can also spread through the air generated by the infected person. Now, these particles and droplets are what your respirator and other items of PPE are designed to protect you from. So what can be done? Well, of course, we all accept that we need to wash our hands. But the use of respiratory protection greatly reduces the risk from inhalation exposure wherever small particle aerosol transmission may be possible. So let's look at the definition of a respirator. A respirator is a device worn over the nose and mouth to protect the wearer from hazardous materials in the breathing zone. We need to understand the difference between a surgical mask versus an N95 respirator. Now, this graphic is from the CDC website and is from the National Institute for Occupational Safety and Health, otherwise known as NIOSH. So a surgical mask is cleared by the U.S. Food and Drug Administration, while the N95 respirators are evaluated, tested, and approved by NIOSH. The intended use and purpose of surgical masks are fluid resistant, and they provide the wearer with protection against large droplets, splashes, and sprays of bodily or other hazardous fluids. So it protects the patient from the wearer's respiratory emissions. Remember, it is a surgical mask, so primarily used in surgeries. The N95 respirator reduces the wearer's exposures to particles, including small particle aerosols and large droplets. Remember that respirators in healthcare, mainly we use the N95 respirators, but there's other types that are used in blocking vapors or painting or other types of dangerous professions. In a surgical mask, there's no face seal. It's loose fitting. In a 95 respirator, we need it to be tight fitting. There is no fit testing requirement for a surgical mask as there is for a 95 respirator. There is no user seal check requirement for a surgical mask as there is for an N95 respirator. As far as the filtration, the surgical mask does not provide the wearer with a reliable level of protection from inhaling smaller airborne particles, and it honestly is not considered respiratory protection. The N95 respirator filters out at least 95% of airborne particles, including large and small particles. As far as leakage, the surgical mask leakage occurs around the edge of the mask when the user inhales. In the N95 respirator, when it is properly fitted and donned, minimal leakage occurs around the edges of the respirator when the user inhales. As far as use limitations, the surgical mask is disposable. It is to be discarded after each patient encounter. The N95 respirator ideally should be discarded after each patient encounter and after aerosol generating procedures. It should also be discarded when it becomes damaged or deformed, no longer forms an effective seal to the face, it becomes wet or visibly dirty, breathing becomes difficult, or it becomes contaminated with blood, respiratory or nasal secretions, and other bodily fluids from patients. Again, this is very important that a surgical mask is not a respirator. So again, face masks do not provide the wearer with a reliable level of protection from inhaling smaller particles. The purpose of a respirator is to protect healthcare personnel by reducing the concentration of infectious particles in the air inhaled by the wearer. Also, it's important to know that there are different types of particulate filtering respirators. So, for example, the N on the N95 mask, this is a respirator rating letter class. It stands for non-oil, meaning that if there is no oil-based particulates, then you can use the mask in the work environment. So other mask ratings are R, which means it's resistant to oil for 8 hours, and P, which means it's oil proof. So of course, in a healthcare setting, we use the N. 95 are masks ending in a 95, which means it has a 95% efficiency. So which means it filters out 95% of particles. Masks ending in a 99 have a 99% efficiency, which means it filters out 99% of particles. Masks ending in 100 are 99.97% efficient. Also, these masks fill out 0.3 microns. The masks filter out contaminants like dust, mist, and fumes. The minimum size of 0.3 microns of particulates and large droplets won't pass through the barrier according to the regulations of the Center for Disease Control. The filtration material on the mask is an electrostatic non-woven polypropylene fiber. So as we remember what the N95 means, the N95 cannot provide additional oxygen. It only filters or purifies the air you breathe. It also cannot protect you from vapors or gases. Vapors and gases can pass through the N95 filter. It also cannot protect you if oil is present in the air. Oil changes how the N95 filter works. For oils, then you need to choose that different type of respirator. So the P95 or the P100. It's always good to check your respirator and make sure the markings on your N95 respirator are correct, because during the pandemic, there have been many counterfeit respirators. Now, they must comply with the NIOSH standards, must be the appropriate respiratory protection for the hazardous conditions to be encountered, and must be used within their limits. So your employer is responsible for providing you with the NIOSH approved respirators. This is done by purchasing NIOSH certified products from a reliable supplier and checking it when it arrives to make sure that it was ordered correctly. Now, while this is the responsibility of your employer, you should also check it before you wear it. So you can look at the brand name, look for the NIOSH logo, the filter class, the efficiency. You can even look at the lot number, the model number, etc. You can look to see if it's in good working condition, make sure there's no holes, no torn or frayed straps, etc. The medical evaluation is another OSHA requirement, and this is for your safety. Remember, this is confidential, and an employer cannot fire an employee based off a pass or a fail. Employees often ask the question, if I have asthma, anxiety, heart issues, etc., does that mean I cannot wear a respirator? So typically the answer is not an automatic no, and this is why the evaluation is done. So gathering more information on these things helps make the determination of whether it is safe to wear or not. A medical evaluation is required once prior to initial fit testing and use. However, it may need to be repeated if there are any conditions identified that may affect your ability to use the assigned respirator. The employer must identify a physician or other licensed healthcare professional to perform all medical evaluations. And the CDC does provide a standard medical questionnaire for this. The employer must ensure that a follow-up medical examination is provided for any employee who gives a positive response to any question, or whose initial medical examination demonstrates the need for a follow-up medical examination. The employer must provide the employee with an opportunity to discuss the questionnaire and examination results with the healthcare professional. The medical questionnaire and examinations must be administered confidentially during the employee's normal working hours, or at a time and place convenient to the employee and in a manner that ensures that he or she understands its content. The employer must not review the employee's responses, and the questionnaire must be provided directly to the healthcare provider. You will need a new medical evaluation when your recommendation letter expires, or maybe when your supervisor tells you to do it again. You have difficulty breathing or other issues while wearing a respirator. There is a change in worksite conditions that may stress your body, or if you have a major health change, such as any lung or respiratory problems, any heart problems, you've had a stroke, or any of the following. The training is the next part of the OSHA requirements. Correctly donning and correctly using the N95 will best protect you, and learning how to do it right is very important. As required by law, you must understand why you need to use the N95 respirator, what the N95 respirator can and cannot do for you, how the respirator works, how to put it on, which they call donning, and how to take it off, which they call doffing, what to do in case the N95 respirator is not working or comes off your face, storing the N95 respirator, and what the annual requirements are to keep using the N95 respirator. So let's talking about donning the N95 respirator. What is the right way to put it on? So there are some requirements prior to using the N95. So it is required to tie back long hair so that it is away from the face. Also, glasses need to be removed, facial jewelry, especially if it's located on the lower face, and any hair coverings. Because glasses or hair coverings may shift while you do your work, wearing the N95 over glasses or hair coverings can cause the seal to break and expose you to contaminated hair. The face must also be clean shaven. So we're going to look at another slide for acceptable facial hair. Facial hair or stubble may cause a break in the N95 seal on your face, letting contaminated air enter the N95. So it's very important. The N95 respirator must be directly on your skin, and the straps must be on your hair or scalp. So as you can see, facial hair is very limiting for these filtering face piece respirators. Step 1 is to inspect your respirator. Always do this. Look for dirt, stains, tears, wetness, the straps not being attached. If your N95 has any of these, throw it out and get another one. If the N95 is individually wrapped, do not use it if the wrapper is torn or taped. Also look to see if the straps are securely attached. Test to see if the straps are firmly attached. You want the straps to keep the N95 snug to your face and not stretch or move once you put it on. Also check to see that it's a NIOSH approved respirator. Again, counterfeit N95s have been found, so do not use the respirator, especially in the healthcare setting if the NIOSH stamp is missing. There are 3 key factors required for a respirator to be effective. The respirator must be put on correctly and worn during the exposure. The respirator must fit snugly against the user's face to ensure that there are no gaps between the user's skin and respirator seal. And the respirator filter must capture more than 95% of the particles from the air that passes through it. Step number 2 is putting on or donning the N95 respirator. So of course, the most important thing is to wash your hands before putting on the respirator to clean off any contaminants. Position the mask in your hand with the nose pieces at your fingertips. Most respirators that are designed to seal to the face have a thin metal or plastic bar at the top of the device. Cup the mask in your hand, allowing the headbands to hang below your hand. Hold the respirator under your chin with the nose piece up. The top strap goes over your head and rests at the back of your head near the crown. The bottom strap is then positioned around the neck and below the ears. And it's important that you remember to not crisscross the straps. Place your fingertips from both hands at the top of the nose clip and slide down both sides of the strip to mold your nose area to the shape of your nose. Step 3 is to perform a seal check. The purpose of the seal check is to see if there are any air leaks each time you put the N95 on your face. With any N95, you should always perform a seal check each time it is donned. Now, it is very important that you not skip this step. So perform a positive seal check and a negative seal check. And we'll talk about this a little bit more in the coming slides, each time before entering the patient or the resident's room. The seal check is not the same as the fit test. So always follow the manufacturer's manual for best practice. Again, each time, every time, because your safety depends on it. To perform the seal check, place the palms of your hands on the respirator to cover the breathing area. By blocking the filter, air will be forced out towards your eyes and face if there is a leak. Adjust the placement and the metal nose piece until there are no air leaks. Now that you know that there are no air leaks, exhale gently while blocking the exit for air to exit the face piece. So ensure that the face piece is slightly pressurized before pressure causes outward leakage. Now, what you want to feel is that the face piece bulges slightly. You don't want to feel air escaping outside the borders of the mask. If you feel that, you need to readjust the seal and try again. Once you get past the positive pressure seal check, perform a negative pressure seal check. Inhale sharply while blocking the paths for air to enter the face piece. Ensure that the face piece collapses slightly under negative pressure that is created with this procedure. Again, if it doesn't collapse slightly under that negative pressure, redo the seal, recheck the seal, and try again. Now, if the air leaks out between your face and the respirator does not fit your face properly. So please do not enter a hazardous area. Readjust the respirator and check the seal again. And if you are still not able to get a good seal, talk to your supervisor and arrange for a new N95 respirator. Step 4 involves taking off or doffing the N95. So very, very important that I'm going to mention again and again, do not touch the front of the mask because it may be contaminated. So of course, the very first thing that needs to be done is wash your hands. Or of course, use the hand sanitizer. But of course, in the healthcare world, we want people to wash their hands before taking off their mask. So remove the respirator by pulling the bottom strap over the back of your head first, and then follow that by the top strap. And remember, do not touch the face piece of the mask. For the reusable masks, wash and safely store after use. For single-use masks, safely discard them after removal. And again, wash your hands or use hand sanitizer after taking off your mask. When we're talking about a few of the procedural things, when we're talking about proper technique, if you wear glasses or safety glasses, be sure that the legs of the eyewear actually go over the N95 straps and not under the straps. And the same goes for face shields. If for some reason your respirator has an exhalation valve, you may need to wear a surgical mask over the respirator to cover the valve, and it must not interfere with how the respirator fits. So you can see there from the pictures the correct way to wear safety glasses. Again, the proper technique for head coverings. The N95 straps must be on your hair, not your head cover. And again, you can see the proper way to wear these from the pictures. So let's move on to fit testing. Why do you actually need a fit test? Fit testing actually helps ensure that you wear the right respirator to protect you from germs and prevent you from spreading germs to others. Now again, it is a requirement under OSHA. So your healthcare facility is expected to provide you with adequate PPE. And this includes a respirator that fits correctly. So again, federal law. Sizes of respirators are not the same across models or brands. And this is an annual requirement. So these changes may require a different size N95 respirator. So if you gain weight or you lose weight of 20 pounds or more, you will need to get fitted again. If you have any major dental work, such as getting new dentures, you'll need to get fitted again. And if you have some facial surgery or an injury that has slightly changed the shape of your face, then you will need to get fitted again before that annual fitting. So what is a fit test? Well, as you can guess by its name, it is a test of how it fits on your face. So a fit test is a way to see if the respirator will seal around your mouth and nose to keep the hazard out of your breathing space. Now, this does involve a trained person, and this trained person must be the one to conduct your fit test. So your manager or your supervisor or the charge nurse or another certified nursing assistant, if they are not trained to do this, then of course they cannot do it. There are two types of fit testing methods. There is a qualitative, which involves a hood over your head, and the quantitative, which uses a machine. Now, in most healthcare settings, we use the one with a hood. I've actually never done the quantitative method. So you will probably be fit tested using the qualitative method. And you can see the pictures down there. Now, prior to your fit testing day, there is some preparation. So it is important to complete these tasks before your fit test day. So number one, there is a medical evaluation. Now, it can be harder to breathe with the N95 on. So the medical evaluation helps to be sure your body can tolerate using the respirator. People can have different medical conditions, which does make it hard to use the respirator. There's also training, this training that we're doing right now that you will need. So your employer is required to provide the respirator training. This training covers how the respirator works, why you need it, when you need it, how to put it on and take it off, and what to do in case of emergencies. And you must understand these topics before your fit test appointment. Your fit test time is for getting fitted and for practicing with someone who is trained, again, to fit test a respirator. Now, on the day of your fit testing, you need to arrive at least 15 minutes prior to your scheduled fit test. It is important that you do not eat or drink except for unflavored water, maybe but no chewing gum, no smoking or vaping, or applying lip cosmetics, which includes lip balm after you arrive, because these items may affect your ability to taste. And I'll tell you why in just a minute. If you know you're going to be late, please let your supervisor know. Dress as you would when you're going into a resident's room. Now, when I always did this, it would be during a work day, so it wasn't a big deal. And maybe for you, it will also be during a work day. So examples would be, if you wear your scrubs, wear your scrubs. If you wear eye protection or face shield, wear that. If you wear glasses, wear that. If your hair is covered, wear that. If you wear your hair in a bun normally, then just keep it like that. If possible, bring proof of your medical evaluation certificate if you needed special approval. And this will let the person doing your fit test know that you were able to use a respirator without causing harm to yourself. Fit testing takes different amounts of time for each person. So you will need to be prepared to wait. So if there are several employees being fit tested before you, you do need to be prepared to spend some time waiting your turn. Now, this is a special note. If, of course, with men, if you have any facial stubble, you will either be asked to shave or reschedule your appointment, and you will need to contact your supervisor if you are not willing to shave. The steps for fit testing are the following. First, and we'll go through all of these in the coming slides. First, there is sensitivity testing. Then you put on or don the N95. Then we have a seal check. Then you will wear the N95 for about 5 minutes. Then the testing will start, and then you will take off or doff the N95. There are fit testing solutions, and this is why you need to be able to taste. So there are 2 types of solutions for the N95 respirator. There is a bitter solution. So it is the world's most bitter material, and it is used to prevent accidental poisoning. So if consumed, it is completely harmless, but it tastes terrible. Then there is the most often used sweet, which is actually saccharin, and it is an artificial sweetener. And this is the one I've always had. I've never had the bitter taste. So the solution is in a device that creates a fine mist, and it's sprayed into the hood that covers your head, and it rests on your shoulders. Neither of the solutions irritate your skin or eyes. Now, if you can taste the solution while wearing the respirator during the fit test, unfortunately, the respirator has failed. The sensitivity testing is the very first step. So it's to see if you can actually taste the solution. So during the sensitivity test, you will have the hood on. You can kind of see that in the background of the slide. Now, your mouth will need to be open and your tongue slightly sticking out. You will need to breathe through your mouth through the entire test. If you taste the solution, after you taste the solution, you must rinse your mouth with plain water to get the taste out of your mouth. And also wipe around your mouth with a wet tissue to remove the solution on your skin. Now, again, both the sensitivity and fit test solutions are safe to use. Then you put on or don your N95 and you do your seal check like you've already been taught. this is a good time to be sure you're doing it correctly. So maybe the FIT tester can double check your process if there is time. Now, again, I do want to say that there are always videos that you can watch of doing the seal check online and also donning and doffing. So wear the N95. You will be required to do this for a minimum of 5 minutes before the FIT testing actually starts. Now, this is to be sure that the N95 is comfortable and you can tolerate the respirator on your face. So if at any time during the FIT test, you actually taste the solution, let the tester know immediately. Then a FIT test solution is used to help detect leaks in the N95 respirator during FIT testing. With your N95 on, the hood is placed over your head and the FIT test solution will be added to the hood. You will be asked to breathe with your mouth slightly open. And if you taste the solution during the FIT test, the hood will be removed. Now, just so you know, the solution will get on your hair and it will also get on your face. Then you get to do a bunch of little exercises. So again, the purpose of these exercises is to see if the N95 seal on your face can be maintained while you perform these movements that you would normally make at work. So each exercise must be completed while standing and be repeated at a comfortable pace for 1 minute. So first, you're just going to breathe normal. And this is to just make sure that your seal is adequate. Then you're going to do some deep breathing. So again, this is to test the seal. Then you're going to turn your head from side to side. Then you are going to move your head up and down. Then you will be talking out loud. And it depends on what the tester decides. You can count out loud from 1 to 100, but they will want you to speak in your normal voice as if you're talking with a resident or maybe a client that is hard of hearing. Then you will bend over and stand up as if you are picking up something from the floor. But of course, don't let the hood fall off your head. And of course, if you're not able to bend over, what they'll have you do is jog in place. And then they'll have you do normal breathing again. And this is to test that if any of the activities has caused your respirator to shift or break the seal. Then they will have you actually doff the respirator, which means to remove, of course. So they will have you demonstrate the proper way to remove or doff or dispose of the N95. So if you have done all of the activities and did not taste the solution, then you will have passed the FIT test. You are now FIT tested to that make and model of the N95 only. Now, if for some reason your facility no longer has that type of N95, or if they change their brand or anything like that, you will need to get FIT tested again to the N95. So remember, now that you're FIT tested, the respirator FIT test is an annual requirement. The medical evaluation will need to be repeated as indicated by the healthcare provider, or if you have a change in health, and the training will need to be completed every 12 months also. So what can we actually take away from all of this? Well, a few things and a few pearls. So Your medical evaluation and training must be done first before you actually get the fit testing. Facial hair and jewelry must not interfere with the N95 placement of the straps or the seal. Bring your other PPE, your head coverings, face shield, and or eyewear to the actual fit test. Be early or on time for your appointment and notify the fit tester if you are going to be late. No eating or drinking. I mean, you can drink water, of course. Smoking, vaping, applying lip cosmetics, including lip balm, before testing. And this would be at least 15 minutes, but I would say longer than that. Just don't even apply it in the morning. Notify the tester immediately if you taste the solution or if you have any discomfort during the fit test. And remember that the solution is going to be on your face and hair, so you may want to plan this when you can shower and wash your hair when you get home. So again, I always had it done during the work days, and I don't remember like feeling like I needed to take a shower. I think maybe I just kind of washed it off of my face. So, in summary, before your fit test, complete your medical evaluation, get your training, and remember this is repeated every year. Get fit tested before the N95 for the first time and annually. Remember, you will need a new fit test if you have physical changes that would change how the respirator fits on your face, or if you use a different model, style, size, or manufacturer of respirator or N95. Inspect your respirator every time before you put it on. Be sure the respirator is in direct contact with your body. Perform a seal check every time you don your respirator. Remove yourself from the room if you have issues with your respirator. Do not touch the front of the respirator when taking it off. Perform hand hygiene before and after you don or doff your respirator. And if you have any questions, talk to your respirator program administrator. Every facility is required by federal law to have a designated respirator program administrator. So I think back to my own attitude of annoyance about fit testing when I first graduated as an RN. And this is the very reason that things need to be a federal requirement. Now, we all realize that fit testing is not fail-proof, right? Passing a fit test does not guarantee that every time somebody dons a face piece, an adequate test or an adequate fit will be achieved. It identifies that a certain face piece has the potential to provide an adequate fit. But to go on achieving this, the person that is wearing the N95 must always put it on and take it off correctly. Perform the seal check and the fit check as described in the manufacturer's user instructions. They must wash their hands. Now think of a pair of steel-toed boots for a construction site. When you buy a pair, you would try them on before handing over a bunch of cash, right? But then, once you have the correct size of boots, you still have to fit them properly. You have to put on socks, you have to put on the boots, you have to tie the laces or fasten the buckles. Now, if you would have purchased a pair of sandals of the correct size, they would not be suitable on a construction site, correct? Of course not. Now, a surgical mask would not be appropriate in a room with a tuberculosis resident or an Ebola resident or a influenza resident or a COVID resident or patient, correct? So providing the workforce with respiratory protection against respiratory hazards is a safety standard. And this is regulated and enforced by the Occupational Safety and Health Administration, or OSHA. So in healthcare facilities, the tight-fitting disposable N95 is the most commonly utilized respiratory protection. And this respiratory fit testing ensures that tight-fitting respirators will seal properly, and it helps protect employees from exposure to these airborne particles such as viruses and bacteria that cause infectious disease. Now, keeping employees safe is the main priority of learning to properly use a respirator and performing a fit test. Okay, my name is Terry Duran, and I am a nurse practitioner. And thank you so much for listening to this course. And I hope you have a great day. And now it is time to take your quiz. And I will move it over to my reference section for a minute or two so you can take a look at it. And then you'll take your quiz. Thank you so much.